The initial concept of using a distal extension of a proximal Tevar procedure was to relieve malperfusion. And so this is our initial publication on the so-called petticoat concept, which stands for provisional extension to induce complete attachment after stent graft placement in type B dissection with malperfusion, I should add. At the time, there was a few patients, I think 18 patients in that paper, and showed the concept that with distal extension, like shown in this case, and an additional bare metal component, you can relieve this kind of malperfusion. You can open up the true lumen completely down to the bifurcation. And here's a case again that shows the complete product after initial stent grafting, distal extension, and a nicely reconstructed true lumen. And at the end, this concept deserved a 1C indication in the setting of acute complex type B dissection with evidence of clinical malperfusion. The good thing about it, it is obviously not obstructing any side branches in the abdominal segment, as you can see here nicely, with the extended scaffolding of the true lumen. Here's a pictorial example of, in my view, the optimal management of a complicated type B dissection. After initial stabilization and lowering of blood pressure to the normal levels, of course, the bypass or in situ fenestration or single branch device to protect the left subclavian artery is used. Then the stent graft is placed proximally and completed with an open extension, which constitutes the petticoat, and then the distal management, if needed, is occluding a re-entry tear, like in this case in the left common iliac artery, in order to avoid backflow into the false lumen. Well, that is the ideal approach. If you can handle that, you get a good result, like shown in this case, with complete obliteration of the false lumen after 24 months, and a nice result of remodeling in this setting. The concept has been adopted by various other groups around the globe. Here's an example from Germano Medicano. The summary is in his publication in 2013. That's 10 years back in time already, where he looked at the evidence of remodeling the false lumen, but also at the distal segment, which nicely opened. But the controversy about avoiding expansion in the distal segment, despite the realignment with opened stent graft, has not been settled, and it's ongoing. We try to address that in the so-called ASSIST trial or ASSIST registry, so to say. This is a propensity score matched analysis of 40 patients against 40 patients with and without distal extension in the setting of acute complicated type B dissection. You see it's multi-center. Various contributors are here in the auditorium today. 40 patients versus 40 patients with complicated type B dissection, either Tevar alone or Tevar with a petticoat. Here's an intra-procedural image that shows you the procedure guided by TOE as well, and the results are summarized here by use of a self-expanding nitinol-based stent distal to the grafted segment, up down to the bifurcation of the distal aorta in most cases, some of them a little bit above, as needed. You see the results summarized in this example very nicely. The true lumen opens from left to right very nicely. And if you look from top to bottom, the remodeling is nicely documented with complete obliteration of the false lumen in the left and in the center part, and in the distal part that is supported by the open stent. Again, the true lumen is wide open, the false lumen almost completely obliterated. If you look at the baseline column on the right-hand side in red, which is free flow in the respective segment, that turns into partial and complete thrombosis after 1 year in the majority of cases, both in the upper thoracic, mid-thoracic, and abdominal segment, as you can see here in green. So there's a trend towards complete thrombosis over time with the additional scaffolding down in the descending thoracic aorta. The outcome analysis, of course, is not really very significant. It's too small in terms of numbers, but it shows you that the combination of Tevar and a bare metal stent made from nitinol is not worse, but rather trending better than the comparator. The summary and the conclusion based on this preliminary propensity-based analysis is that the concept of distal bare metal extension was initially developed to abolish residual malperfusion, petticoat. The concept showed benefit in terms of malperfusion treatment and protection of side branches. It ensures distal realignment of the dissection lamella, but it also improves false lumen obliteration, so-called remodeling in acute and subacute setting of Tbad dissection with malperfusion. Thank you very much.